Today's guest challenges the idea that medicine and spirituality belong in separate rooms. Dr. Georgia Tetlow is a physician, educator, mentor, and lifelong seeker who believes that healing happens when we honor the full human experience, body, mind, and spirit. In our conversation, we explore what it means to stay connected to your values within a conventional system, the role of relationships in healing, and why nervous system support may be just as important as information when it comes to lasting change. This episode is ultimately about remembering the human being beneath the diagnosis and the healer beneath the professional role. One of the themes that kept emerging in this conversation was that healing happens in relationship. Whether we're talking about patients, practitioners, mentors, or ourselves, transformation rarely occurs in isolation. I hope you'll listen for that thread as you enjoy this conversation with Dr. Georgia Tetlow. Hello, and welcome back to the Spiritually Curious Therapist. Today we have a very special guest, Dr. Georgia Tetlow. Dr. Tetlow is the founder and CEO of Philadelphia Integrative Medicine, also known as PIM. PIM is a center for healing and a national clinical mentoring site since 2009. Board certified in integrative medicine and physical medicine and rehabilitation, and a certified practitioner with the Institute for Functional Medicine. She is also a Bravewell Fellow of the Andrew Weil Center for Integrative Medicine. Dr. Tetlow received her medical degree from the University of North Carolina at Chapel Hill and serves as a clinical assistant professor at Sidney Kimmel Medical College. Through PIM, she directs a national clinician mentoring site offering programs via Zoom and intensive on-site hybrid formats. Dr. Tetlow is a frequent featured speaker at medical conferences and summits on the real-world application of functional and integrative medicine. Her clinical excellence has been recognized by physician peers with the Mainline Today Top Doctor in Integrative Medicine Award for 8 consecutive years. Her academic achievements include the Rex Newton Research Presentation Award, the Arnold P. Gold Foundation, Leonard Tao Humanism in Medicine Award, and the Brody Award in Medical History by Duke University. She also facilitates the Free Healthcare Workers and Integrated Professionals Group for Self-Care Monthly since 2015. Welcome to the podcast, Dr. Tetlow.
Thank you so much, Jody. Thank you for including me today.
I am really excited to have you here and learn a little bit more about who you are and how you came to do the work that you're doing, because I met you through these professional groups that you have monthly, which I've been very excited to attend and network and meet all of the people who are doing this kind of work. So I'm really excited to be able to take the time to get to know you better. Tell us a little bit about you and how you came to do the work that you do, especially moving into integrative and functional medicine and going the route of holistic care.
So I am a physician and I take care of patients and I love that work. And I have a clinic so that I work very closely with the other practitioners in the clinic. We discuss a lot of the cases together and we collaborate together. And I'm a business owner, so we have a sort of a healing vehicle, a healing space. And in addition to patients, we're also helping to train, mentor, and inspire other healthcare practitioners. So on the outside, it's clear that I have these two different roles. The healthcare provider mentor is a lot about teaching and understanding where someone is and what they're interested in creating in their own clinic, in their own work, how to evolve their practice of medicine so that they can use new tools and think in new ways and become more holistic in what they're doing. I think that it's clear that on the outside, I have these two different hats that I wear. And I would say that on the inside, I am very much a spiritual seeker. I see the whole continuum of my own life as a learning process. I see opportunities in my relationships and my patient care and my clinic challenges as opportunities to grow. I'd say that I see everything in that sort of growth mindset, growth context, and very much understanding that I have a soul. My team members and my patients have a soul. There is not really a question about that. And I do not interfere or prescribe any of their ways to see themselves or what brings them joy or what brings them spiritual awareness or health on all levels. I am their physician, recognizing them as a really mind, body, and spirit, and making sure that I don't just see them as a body or a body that's broken.
Yeah, so that's so powerful. When you say mind, body, spirit integration, yeah, where do you feel that in your body right now? How does that show up for you?
Oh, it just makes me want to exhale. Right? There's a lot to exhale. I will frequently hear from my own patients their experience of being a patient in a conventional medical system. And I just feel such a sense of relief. I feel it in my body, I feel it in my belly, I feel it just a softening in my heart
Mm,
that many people will share that they do not feel that there was really any time for them, that they were heard in what they were saying, that let's say they had done some research or they had learned about what was happening and they wanted to interact, ask questions, and actually discuss their care. There's just not a lot of receptivity to that. And I think that when they come in and they feel like they know, and they hear and then they experience that we want to walk with them and also be the clinician and do the right types of tests to understand where their autoimmune disease and thyroid disease and bone health and all of their high blood pressure, high cholesterol, all of their chronic illness challenges, to understand those. We want to do our job, but also we are walking with
mm.
people. It makes me feel like I can breathe, like I can exhale, like I can soften, and also we run our own ship. So we have our own clinic. We do it way the way we think we should do it.
Yeah. Was there a moment in your life or in your training that really stands out to you in which you recognize the importance of this shift from a conventional medical model to this more holistic way of being?
That shift did not occur when I was in training or early on. It happened way before because I was a yoga teacher and a yoga
Mhm.
therapist. And then I realized that in order to really serve my patients, sometimes it's not appropriate to breathe through symptoms that really need a little bit more workup, a little bit more to understand. Someone says their belly hurts, it doesn't make sense for me to just say, breathe through that. That did not feel comfortable. So I love the body and I decided to go into a traditional healing. I didn't do an alternative degree, I did an MD degree. So I knew all along that I wanted to keep myself and my values. And it wasn't like something that happened during the training. It was something that I worked hard to keep contact with throughout the whole process. And I did work hard and do things to keep my perspective and also because the way I was trained was not necessarily, I was trained to see, create a problem list and treatments are a lot of drugs and surgery. And I had wonderful mentors and a lot of great teaching and a wonderful medical school. And I loved my medical school experience, but I had to maintain also my way of seeing a holism in the person and then go on to do additional training after med school through my fellowship and through my Institute for Functional Medicine certification and other training just to be a holistic doctor.
And did you know all along going, because it sounds like you came into this with the mindset of providing holistic care ultimately.
Jody.
Yeah.
I knew all along that I feel like it's doing it the right way. So that for me, that is the right way to do it. It is seeing the person and also seeing the different levels. There's an emotional life and a spiritual life to every person, and they're going through something, symptoms or an actual illness or multiple illnesses and challenges while they're navigating their life. And it's not going to work for me just to see the physical level. It's not going to allow me to fully listen and partner and engage with also root causes unless I understand who this person is, what they care about, and also why they're there, and then to dig deeper to really do the medical part, which is great because I get to be a medical doctor and I get to actually practice medicine. I'm not just practicing understanding and being open to an emotional spiritual level. We're doing that and we're seeing the person as a whole person and being a physician. I'm being a physician. That feels really good.
Yeah, what an incredible combination. What was it like to you to stay connected to that throughout a conventional medical training?
I was really worried in the beginning.
Yeah.
I had some anxiety. I thought, okay, I've made this decision. And I got accepted to UNC Chapel Hill Med School. I thought, okay, here we go. I didn't know how it was going to turn out. Am I going to keep my values and be able to practice the way that I felt I wanted to practice? And what I did was I worked with a somatic therapist, really incredible person who partnered with me, and I saw her once a week for some time before I started medical school. So I started medical school in 2000. So I saw her for some time before that, and I saw her for every week the entire time I was in medical school for 4 years.
Wow.
And then all 4 years of residency. So I
Mhm.
did an internship year and then 3 years of residency after that in Philadelphia. And then I did 2 years of fellowship. So that was 2009 and 2010 calendar years until a little bit of time after my fellowship. And then we decided to be complete. I saw her every week for those years. And what she helped me to do was to acknowledge and to process my experiences, including some very challenging experiences as a medical student.
Yeah.
I went through some very challenging experiences. Some of them are shared experiences that are really tough, like when you're going on your third and fourth year, going onto the medical floor and asked to do certain things on time in certain ways, and you're on. And there's a lot of responsibility, and then becoming a physician as a resident. So I invested a lot of time and energy into a therapeutic relationship that I felt was helping me to be embodied and continuing to awaken and continuing to be aware and to grow.
That is quite a commitment to doing your own work while going through a very, sounds like rigorous program some of the time, or maybe more than some of the time, which was like in opposition to the values that you were trying to hold on to.
I don't know, I would say opposition, because I think that these are all cultural experiences. Med
Mhm.
school is a cultural experience, and it's considered okay to shame people out loud. You shame a nurse if they don't do what you think that they should do. You shame a medical student. And also, there's certain dynamics and certain things that we might actually call verbal abuse that are actually considered normal in on the floor, on the medical floor. And there are certain rules and understandings, assumptions, some of it's spoken, some of it's not. And there's a whole training, and it's like a cultural training. And so I wouldn't say that the work that I did personally was in opposition. I would say that it was keeping and nurturing and watering the threads and the roots to my own awareness. Like, let me continue to acknowledge and to be strong in reflecting on an experiencing, seeing what I want to take from it and what I don't. It's like, oh, that just happened to me. I don't want to do that to anyone else. I'm going to be aware of what happened. And then there's a lot of feelings and a lot of fear that came up. I would say that it was an intentional commitment to see myself and my experiences with a positive frame and also take responsibility for myself and also understand what do I not have control over. This is not mine. This is how it works here. And I'm going to be in this system. It's like you're in a family, you're in a workplace. This is how it works here. And discerning when to speak up, when not to. And also, I'm a team member. I have a job. I have to do my part. And I participated in the system. And I decided to go in and through the system, not to be a naturopath, not to be outside the system or to do a modality that wasn't part of the medical system. I chose to be in the system, and I am in the system.
So even as you say that right here and now, what do you notice in your body?
I'm part of a medical system. I'm a conventionally trained, initially purely conventionally trained physician, and I know how much happens to patients. I feel like I'm also having to take responsibility for, I'm part of that culture that does this to people. And part of my response to that is to have a clinic, which I think does things differently. I know does things differently. So
Yeah.
what comes up for me is the system is very unhealthy for patients and for clinicians. And the system is set up to serve as a payer system. It's a bottom line system, which is intended to generate income. And there's stakeholders and different members. There's a pharmacy and there's the hospital, there's the clinic, there's all these different things. The system, the conventional medical system, is designed to make money and to be a business engine first. It's not designed for patient care first.
Mm.
So we try and grapple with that as a clinic. As for us, we need to be viable. We need to make sure that we make our payroll, and we also need to make sure that we're organizing ourselves with our top priority is patient care and setting ourselves up so that what we do supports listening, validating, never dismissing a patient, and then bringing in the technology of the testing. So there's a lot of things you can do to understand symptoms and illnesses that's not part of conventional. So that's what we train the clinicians in. It's like, what can you do to help resolve an autoimmune illness, not just suppress the immune system and suppress the symptoms? What can you do to change the bone health picture of the osteoporotic patient, the woman? She's menopausal, and the expectation in conventional is it's going to go down every 2 years. She does her DEXA, it's going to go down. That's just what happens. That's what, no, you can change the course of that patient's experience and their care so that they can have improved bone density every time it gets checked. So we do that. We resolve Hashimoto's thyroiditis. We resolve the root causes of inflammatory bowel disease. We actually have a very rewarding and rich medical practice, which we share in together and work on together as a practitioner team with great support from our admin team. And we practice medicine the way I think we should practice, which is really trying to help people to be well and to be healthy and to not have illnesses and categories and diagnoses and least medications possible and the most well-being possible and not to need us. Although maintenance, to need us for maintenance care
Yeah.
and for preventive purposes.
Yeah. And so you mentioned this earlier, this idea of you wearing these two hats, one as a business owner and one as a holistic practitioner. And what I'm hearing is both are very important to you, and how to do both of those things successfully in a system that doesn't necessarily support both of those things. What is that like for you?
We are our own ship, so this is our own system in a way. We can decide how we run things and how much time we spend on things and how we treat patients and what tools and tests we offer here. So there isn't opposition, right? So there is, we are a physician and we're a clinic and we're healthcare providers and we're a business. So in some ways, it's an advantage because it's not a Titanic. If something is not right, for example, what would be a good example is we're not spending enough time. We don't have the time to educate or to hear our patients. We can fix that. We can fix something in the model. We are also needing to be in reality and being able to pay our bills. Our biggest bill is our payroll. And we also need to figure out how to make this work. So, what we do is we do our best to find the balance so that we're a healthy business, we are not exploiting anyone, and we provide the best care possible. And then we share that model with other clinicians so that as they're trying to figure out how to transition to integrative medicine, functional medicine, they're purely conventionally trained, and now they're doing coursework or fellowships, and they're trying to, now they need to know how to apply it. How do you do this? How do you set up the clinic? How's the clinic organized? How many patients do you see a day? When do you see the patient in follow-up? What tests do you do to fix a particular condition? They come to see us to mentor and learn how to do that. And we've tried to figure out how to be a clinic and to run and to be the best patient care. And then, of course, we don't have all the answers, but we do have some good answers to offer. And we have lots of, we're very full with our mentoring program to help support and mentor clinicians.
Yeah, what an incredible offer. Who are the type of physicians who reach out to you? Like, where are you seeing those folks coming from? What are they looking for? What are they needing? Obviously, they want they see your clinic and they want to learn from you and do what you're doing. But what are they coming with the same kind of background? Or what's their experience?
I would say that primarily physicians and nurse practitioners become
Hmm.
mentoring clients. And for example, I have a mentoring client who just did a free consult with me a couple of days ago, and he is a business owner. He owns the clinic and he employs several physicians, several nurse practitioners. And he's in Georgia and he wants to, in his rural community, and he wants to offer functional integrative medicine. And he's done some of the coursework because we're not going to replace some of the coursework and the training and the curriculum. We want people to take the courses and the classes and get the framework and get their book understanding and their academic context. And then he wants to know how to do it. He wants to know what to do on Monday morning. He wants to know how to structure appointments and how to take care of different illnesses. And so he's going to come in, and so primarily nurse practitioners, doctors, he'll come in for an intensive week and then he'll do follow up online. So he'll come in, take a flight from Georgia. He'll stay here for Tuesday through Friday. He'll have dinners and breakfasts and meetings and see the patient care and discuss what he needs to know for his clinic. And we're going to personalize the whole process. There can be one or two clients that come in for an on-site week. Then he'll have his one-on-one time, lots of hours of time after that. That's part of an intensive clinical mentoring program. In his case, and that's very common, he is a practicing clinician who wants to integrate integrative and functional medicine and has done coursework or some coursework. Physicians and nurse practitioners can sometimes have completed the fellowship at Andrew Weil. There are other fellowships, but that's usually the most common fellowship that people will have. Like my nurse practitioner who works for me, she completed the fellowship that's usually for doctors, the Andrew Weil 2-year fellowship. And then I recruited her 7 years ago because I just loved her. She was a mentoring client. And I just said, hey, I'd love to have you work with me in my clinic and move from Texas. And she did. She moved her family and then she came here. So these are people who are practicing. They're doing well. They have but there's something missing. What's missing is the way that they're practicing, and they know that there's another option and there's another way to practice medicine well. And they want to understand how to do it and how does it work. And it can cut your time to make the transition in half when you do a mentoring program. So I wish I had that when
Hmm.
I was going through my conventional to integrative practice. I wish I had someone to help me. So I do that for others now. And there's lots of different ways that the programs can be adapted, but that's usually why people are coming and the phase in their career they're coming. And it's very rewarding and very personal. I love to teach. Teaching is something I just love to do. So that's how I incorporate it into my work.
What's happening between you and, let's say, your mentoree in those experiences?
I think there's all kinds of things happening. There's butterflies, and so I think that there's really good questions, and I think that there's trepidation at first, and I think there's aha, oh, this is how you can reverse thyroiditis. They have Hashimoto's, and I never even checked the thyroid antibodies. Now I check the thyroid antibodies. 4 out of 5 people who have hypothyroidism have it because they have an autoimmune disease. But a lot of conventional practitioners never check the antibodies. They just give them thyroid medicine and say, well, I know why you have hypothyroidism, but I think you're going to need this medicine and you're going to need to come back here for the rest of your life. And I'm going to need to monitor you and I'm going to give you a medication for that. And that's it. And so the practitioners coming in, they're like, oh, I don't have to say that to my patient anymore. I can give them a model where Hashimoto's thyroiditis, there are certain supplements and certain approaches. If someone starts to have an autoimmune disease or diseases, that means their immune system is regulated. Then there's usually a reason for that. And then
Mhm.
you can do various things. For example, look at gut health. You can even do a comprehensive diagnostic stool study, and you can see what is the health of this immune environment. If 80% of your immune cells are in your gut, does your gut have the good bacteria? Does it have bad microbes? Right? There can be parasites and there's all these things that can be in there. They're dysbiotic and very inflammatory. Is there a sign of inflammation? Are the markers high? Are they digesting? You can test all of this, and through testing and then caring for the person so that they can see the results and see that there's improvement, And there's certain things that can be triggering the immune system to do that. We address those, and I would say we resolve a case of Hashimoto's every week. So that person is having an aha. They're having, oh, phew, thank goodness, I know how to do this now. They're having, I think that some people go at the right speed for themselves, some people go too fast. So that we work with them to maybe they don't do every single specialty test when they first open their door. Maybe they do several and they get comfortable with them and then they bring another one in. Because there's hormone metabolite tests that help to prevent female cancers. There's tests that look at where allergies come from. There's testing. There's technology. And it's not part of conventional medicine yet. It will be. All of these tests are CLIA validated tests. They're independently validated tests. They are consistent and they say what they're supposed to show. And the data shows that this is what you need to fix the medical condition. There's a lot that they're going through. I never quite know until I ask and find out. So then we traveled together, and it's very rewarding when you teach someone how to fish, right? I don't have to do it. You teach them how to fish. I have a wonderful mentoring client yesterday. She was asking me about an approach to an autoimmune illness. And I said, what do you think? We've talked about this before. Let's just regroup. We went back into some of her notes and she's, okay, I just need to absorb it. I've heard this before. I just need to take it in and feel like it's part of me, like it's operational knowledge that I can apply.
Yeah, it sounds like there's a lot of detective work, like some a collaboration between the team members, but also with the patient, and really digging a little bit deeper than, like you said, conventional medicine goes, which I still don't fully understand why they don't do that, but that may be a totally separate conversation. And even as I'm listening to you talk about this, I'm feeling some excitement about the possibilities that
Yeah.
with each and every patient, there are many potentials, I imagine.
It is so exciting, Jody, because people are told, I don't know why you have this, just take this medicine. There's nothing I can do for you. Or they get told there's nothing wrong with you.
Right.
And the fact is, there's often actually a different answer. Actually, there is an understanding of what's going on. There is an understanding of what to do to help correct it. There's the patient playing a role in the solution, which is much more empowering. That's why we need time for education and to talk about test results. In terms of detective work, there is detective work for the mentee and me. So we meet for a session and then we talk about the intensive week to make sure they get their needs met. And then after the intensive week, we have a session. And then the rest of the sessions are used for what they need to learn, what they need to, we figure it out. So there is some detective work, but a lot of just, the rest of it's just learning and experiencing. The detective work with the patient, like they'll come in and they have an hour appointment, sometimes longer, to share their story. We've already done a really extensive intake, so we already know some of the medical details, like they can tell us when they got a diagnosis, they can send us lab work in advance, they can specialty work, specialty tests in advance. We have a lot and we prepare in advance for every appointment. Then when we spend the time with the person, we are listening. And it's always unique. They walk in and it's a 25-year-old and both their mom and their dad are there. This happened to me yesterday. And this person had been diagnosed with inflammatory bowel, but it had never been explained. And I said, did you know your testing shows that you have inflammatory bowel disease? It looks like, based on your history and everything we're looking at here, it looks like you have ulcerative colitis. And then he looked at me and he said, oh, yeah, someone did tell me that, but they didn't tell me what to do about it. I was in the process of moving and they didn't give me medicine. They didn't give me a follow-up appointment. And I said, oh, so you actually knew that? Like I had a whole new patient appointment. This is the first appointment to review their test results, their blood work. We had decided on a stool study because he has abdominal pain, 7 out of 10, round the clock. I think we'll take a look. We'll do this stool study as well as the comprehensive blood work. So it turns out there's this discovery process. Like
Yeah.
this is an example of someone who's not been cared for. We even had some answers. So the sleuth work, the detective work, it's always unique, but you have to go at the pace for the person so it's doable. You have to listen and understand what's important to them, what to do first. You can't do everything at once. And then that's the art. The art is not overwhelming them, not overwhelming yourself as a practitioner, because you are looking at everything, right? You could easily overwhelm everyone. And then you're communicating in that patient experience with the patient, and then their mom and dad are there. And so you're all coming there together and making sure you're looking in this, just the body language. AI could never do this. AI could never read the body language. They could take test results and spit out what they think the likely conclusions are. Of course, AI is not supposed to diagnose anything. A healthcare practitioner is supposed to diagnose something, and people aren't supposed to diagnose themselves, although no one's got that memo. I'm not supposed to diagnose. You're supposed to actually be in a care experience to be diagnosed by a practitioner. But it's an art and sleuth work. It's intuition. It's listening, it's
Mhm.
caring, and then it's making a lot of micro adjustments, whether or not it's a mentoring client or a patient, because the purpose is for them to get what they need, for their nervous system to come along in a stable and steady way where their nervous system's still able to take in a learning state. Because parasympathetic, right?
Yeah.
Rest and digest and learn and sleep and rest. We can't do that if we're wired, tired, and if we're stressed and if we're overwhelming ourselves or others. It doesn't work very well.
No, it doesn't. And I hear so often as a therapist, especially working with folks who have chronic pain and chronic illness, how overwhelmed they are when they go to a physician, and the anxiety starts the night before because they've had so many activating experiences or experiences in which they weren't being held in a way that they needed to, and whether that was because they were overwhelmed with information or given diagnoses like your example, and but not told anything about it. And so what am I supposed to do with this? And the dreaded, we don't know what's wrong with you. You're just going to be in pain or have these symptoms for the rest of your life, and you have to figure out how to deal with it,
Yeah.
which is, yeah, really
It,
upsetting for folks.
it's upsetting, it's anxiety provoking. So, a couple things on that. That's really helpful what you were sharing, just reminding of the experience of being a patient. I think that the patients have anxiety, and I think that the practitioners also have a lot of stress and anxiety. And I also am a business owner. And so it's so interesting how I also want to be a workplace where my staff, my practitioners are also operating under the least stress possible. And that can also be a challenge because someone's learning how to take care of a lot of different angles, a lot of different levels, a lot of different information. And they're also people who give and they're generous. And they need to have, and I need to have, and you need to have, practitioners need boundaries, right?
Yeah.
They need to know what their scope is. They need to know what they do and don't do. They know when to stop the appointment. They need to know when they're not comfortable and they say, hey, this happened to me at lunchtime. I actually need to make a note. There's a patient who's not understanding that they can't get all of their care through the portal, that they actually need to come in for an appointment to review their test results and talk about next steps. And they're just trying to basically just ask questions and think that the test results will do the whole answer. And actually, that isn't how it works. It doesn't work well. It's not good medicine. It doesn't work well that way.
Mhm.
So I will call this patient and talk with her and say, if you need something so that you can get back into care, but we actually can't just send you one-way messages based on testing. We actually need to find out why your thyroid is blocked. We need to figure out if you want this medicine or that one. And then we also need to talk about your ability to check it to make sure it's going to be working and then come back to make sure that we're on the mark. Yes, anxiety is so important to acknowledge. I think some anxiety can be like eustress. There could be something positive from not sure how it's going to go or what's going to happen, but fear is never helpful. Like being afraid of the doctor, afraid of the medical experience, being a clinician who is constantly overwhelmed, that's not healthy. It's not good for anyone. And so we try and reduce that and address that the best we can.
What are some ways in which you do that in your practice? Because I'm really appreciating you acknowledging how the clinicians also overwhelmed and the weight of the work that you all do, and especially depending on volume and expectations and business side, and there's just so much to balance. And I think about the parallel processes and how when clinicians, helpers, healers are being taken care of, their patients are also being taken care of. And if they're not, then the patients feel that also. And it really comes down to the clinicians own work around regulation and self-care and the environment in which they're in. And so that was a very long way of asking the question, what are some ways as a business owner and someone who's very aware of this, what are some things that you might do to ensure that your folks are being held and taken care of?
What a beautiful question. And this is the core of mentoring. This is also the core of how to support my fellow practitioners, because I'm the medical director and I'm supporting them to be healthy practitioners in my clinic. But this self-regulation and self-care is the foundation for doing applied integrative functional medicine well. So that's all the mentoring clients. So we have a program called Honor Self, and then we have information on that on our website in the provider training tab. So there's assessments where you can look at what's the state of your relationships, what's the state of your sleep, what's the state of your eating, what's the state of your movement. There's a statement that you can say you're doing well or you're stuck. It's a statement that says, my body and I, as I have time and interest in sexuality, I actually have time and space for that in my life. And that's always the question that's always, I remember I would present some of my self-assessment questionnaires for self-care and honor self program. And that's always the one where like we're doing okay with the self-care. Like I'm aware of and working on these angles, but I actually wasn't thinking about that level. I wasn't thinking about being relaxed enough to be able to like, how am I doing with all aspects of my being? And having time and energies like fertility and pleasure, these are things that will not be prioritized if you are in a stress state or squeezed or overwhelmed. What we have for regulation and for self-care is we have core principles. So we have certain tenets and certain boundaries and certain guidelines for the practitioners who work in the clinic. And we have a review process every 6 months. And then it goes through like, this is how much time it takes me to prep. This is how much time it takes me to document. And I am reaching out to clinicians in the community and I am getting my notes done on time. And it just basically is like, how am I doing? And you assess yourself. And then we discuss it every 6 months. So that's the foundation. And then the personal process is like people will have certain things, like some person will have a real hard time taking breaks. Some person will they don't manage time well. They always go over time. And then all the break times that are in their schedule and their end time is not actually their end time. And then we do a combination of seeing if there's something structural causing the problem or if it's also them. And usually it's a combination. But sometimes it really can be mostly just someone is just not a time-based person, right? That's going to make it hard. And there's going to be more of a learning curve and there's going to be a tension. So I think that there's my own practitioners, and then this is always an angle and a level with mentoring. People are transitioning to integrative functional medicine because they want to be healthier, happier, more fulfilled. And it doesn't work if you bring all your old baggage and old patterns. It's not as cool, but you still bring them with you to your new
Mm-hmm.
medicine. And now sometimes your own boss, then if you're running your own business. So this is always an angle and a level. And it's very personal because some people, they don't just read a book and get it all, right? You need a coach. You need someone who's going to say, I'm noticing that you're so busy that whenever we talk about something, you ask the same question each time because you haven't taken in what we've talked about. Or maybe they'll say, I'm realizing I'm going too fast and I've got 10 tests and I need to learn the three first. So the self-regulation is something that can come forward and be managed much better in a therapeutic relationship with someone who cares and knows, and also can talk with kindness and care, being kind about it. And then we're much more likely to be able to shift because we're being seen. We're seeing ourselves and we're being seen. And that's therapeutic, ideally, not traumatic.
Yeah, yeah, absolutely. And so I'm hearing throughout everything that we've talked about how important relationships are to you. Does that track?
Yeah, it
Yeah,
tracks. It
yeah.
really does.
And yeah, can you say a little bit more about that?
I think that relationships take time and energy, they take effort, and they're full of growth and learning for oneself. Also, when do you end a relationship? When
Hmm.
do you tell a patient, I don't think this is helping you? Or is this helping you? What do you want to do? And you actually say one of the options is for us to end this, or for you to go and see someone else. I don't tend to do that as often and as easily, but I think that relationships are something I'll keep. I'm the one where there's a challenge in a patient and they give them to me.
Mhm,
So
mhm,
then I'll follow up and manage boundaries, but I never want to give up on someone. And also, our patients are very self-starting, they're very motivated. They're people who really do well when they have all the support and they have information. And so, relationships are everything. Relationships and being able to manage the needs of the clinic, the needs of the patient, the needs of the practitioner, right? And of
yeah,
course, the team members are the clinic, right? The team members, it has to work. So, we always think about those three things. And I think that I've learned a lot about how to be thinner skinned, more sensitive, more flexible, more patient, and more loving to
mm,
myself and to my colleagues and to my staff, to my patients, because we just need a lot of space and patience. We need time.
yeah, yeah. Where do you see the future of integrative and functional medicine going?
What's happening with artificial intelligence is that a lot of people can order their own lab values and then they can self-diagnose and they can put information into ChatGPT or another engine. And then they can take care of themselves a little bit more than they could before. So some of those folks might have come to us, but now they come to us a little bit later. And we notice how they sometimes will not have it correct. They will not have asked the right questions or been on
Mhm.
the right track. And also, healing and changing doesn't happen when you know. It happens when you feel enough nervous system support to actually be different.
Yes, exactly.
The human connection outcome. So the future of integrative functional medicine is for there still to be healthcare providers because really scary is that there's robots. There's messages like this in the movies now. I saw a recent movie and there was no healthcare provider. They're on a spaceship, they're alone, there's robots. They get sick, they almost die, and then the robots fix them up and they suddenly have a medical gown on, suddenly have improvements, and they suddenly they're all healed up. And there was no person involved with the interaction at all.
Mm,
It's subtle and not so subtle how we're being told and learning that there aren't humans in healthcare, there's AI. So the future is the humans are celebrated. That's what we're doing in our clinic, and that's what we know. We know that patients have to be at the center. The system has to be set up for the patients, not for people making money. Okay, so that's not rocket science, but it's not in place right now. So humans at the center, meaning patients at the center, and also the system has to work for the healthcare provider. They need to actually have peer support. They need to have time to process difficult interactions. They
mhm.
need to have standards for their own emotional health as opposed to just denying all their needs. There's a percentage of people that come to see me that do not pee, poop, eat, drink on their entire shift. So I'm over here talking to my patient about diet and exercise and sleep and about mind-body practices. And then I'm really talking about the real strong diagnostics from the specialty testing and understanding root causes for their illness and what to do, how to prioritize. But over here, we have someone who is not actually going to the bathroom, not drinking water or eating,
Yeah.
and the shift is 12 hours. Okay. So the extremes and the expectations, and it's very busy to figure out when those lunch breaks are. And it's worse with clinicians than other medical professionals. But I think everyone is affected in medicine. There's not actually a training program and a curriculum for self-care and nervous system regulation. There's not an
Interesting.
awareness of nervous system.
That just blows my mind.
Yes. So I would say it's changed a little bit recently, but when I was seeing purely conventional physicians coming to me for mentoring because they didn't know what to do and they were experiencing symptoms and also very low mood, and there's a lot of suicide in conventional healthcare. I would say that at certain points in my career as a mentor, because I've been doing this since 2002, I would say that 40% of the physicians would say that to me. They would say, I don't eat, drink, pee, or poop for 12 hours. And
Yeah.
I would say, how is that possible? And I think maybe they would urinate, but these are surgeons that are in surgeries for 6 hours at a time, right? And that's what happens when you're a surgeon. Either you might have to gown out and gown up again and scrub in, scrub out. But physicians are asked to do these things and to
Yeah.
perform it without speaking up or giving feedback and saying, is there some other way we could do this?
Yeah, and I imagine that they train their bodies to be able to hold those things or not have needs. And that doesn't just go away once you exit the operating room. That
Right.
maintains throughout one's entire life.
Yeah. So some
Yeah.
of those positions are paid well and they have a lot of freedom financially, but how much there's a big cost and there's privilege and there's status, but there's also physicians who aren't paid well, who work extremely hard in community clinics and they don't have a lot of resources and status and they just care so much, but they self-sacrifice.
Yeah.
So there's different versions, different flavors, and patients have different flavors of how they do self-care and how they don't do self-care.
Yeah.
There's such an opportunity for us to just let's just think about what we're doing, and the priority is the humans. And it's human connection. You said nervous system self-care.
Yeah.
What's our grade? 0 to 10. Oh, we're at a 2. Okay. We're going to work to getting to a 4. We're going to work to a 6. We're going to work to an 8. What does an 8 look like? An 8 looks like we have food and we have time and we eat it in a way that's good for us. Not just the content, but the way in which we eat is actually healthy and
Mhm.
spacious. And we're actually breathing and tasting our food. That's what an 8 looks like.
Yeah. Yeah. So I'm going to start to wrap us up here. And what I always ask folks at the end of an interview, is there anything that we did not talk about that you would like people to know?
I would say that I see patient care as joining with the patient. And that means not blurring in an unhealthy way. That means being with them.
Yeah.
And I love that. I feel like the body and the person is an energy system and they've got community forces acting on them. And energy, body as an energy system is a really important way to see healing. We have osteopathy in our clinic and we understand the whole the system of we're removing things that are in the way of healing. And I think that the opportunity is for me as a healthcare provider. I've got to do some stuff which is a little complex and a little bit technical and choosing tests, interpreting tests, applying tests, while at the same time going a completely different angle. It's like also being present. So these are the two important ways that an integrative functional medicine clinician needs to operate. And those are different skill sets. And sometimes people
Yeah.
only have one of those skill sets. And we need to strengthen and balance. If you want to do this, you have to be able to do both. And the other thing I would mention that I think is really important is the subconscious. When people have illnesses and you help them and you take care of something and they no longer have a painful hip, it actually didn't need a hip replacement. It was intestinal dysbiosis, like they had bad bacteria and they had inflammation. You address that and they don't need their hip replaced. Then they develop something else. Once you do one thing, it's like there is something in the background to be addressed. It's not actually just what's up front. Tell me this is what conscious, like I know what's happening. So the role of the subconscious in health and healing is really important. I would say that 1% of our patients actually engage with that level. And we
Yeah.
have lots of tools and techniques, but they're not sometimes ready to talk about some of that. And we are talking about it directly and indirectly. And that's a whole area that's very exciting. And
Yeah. Yeah. Absolutely. If people want to get in touch with you, if they want to learn more about your clinic, if they want to learn more about your mentoring program, what is the best way to reach you?
you can put in Philadelphia Integrative Medicine into the computer, do an internet search. You can also put my name in, Georgia Tetlow, and then you'll find our website, which is philly-im.com. So philly-im.com. I am as I as in mom, I as in I, M as in mom.com. And there's information about free consults. Everyone is invited to do a free consult. It's a phone call. And it's talking about how would you help me? This is my situation. Do you do this? And you can see on the website all the conditions we treat. So a lot of questions can be answered. But if you'd like a free consult, and they're not necessary, but if you'd like to talk with a practitioner, you can set that up. And then there is a provider training tab, which got all the information about doing one-on-one. You can do a single one-on-one session, and
Mm.
then you can have a sounding board and just say, I don't know, what about me? What about me changing my career and life as a healthcare practitioner? Does this apply to me? What would I do? Where would I start? Sometimes the pre-mentoring consult doesn't end up in mentoring. It ends up in that person's next step for themselves.
Yeah.
And there's a lot of resources on the website for clinicians. And there's a lot of resources on the website for everyone. Our blog is a great resource for education, and it educates clinicians and it educates patients and prospective patients. You can sign up for the blog, and also signing up for the newsletter will give all these kinds of information, and then also a link to the blog when it comes out. And also healthcare practitioners, I would love for them to come to the monthly group that we have, Healthcare Workers and Integrative Professionals Group, HCIP, Healthcare Workers and Integrative Professionals Group. We've had that since 2015. It's a monthly meeting. We've had more than 115 meetings so far. And I love that because it's confidential. All the topics are great. The topics are how do I not carry the weight of the world and my patient care home with me? How do I figure out my 10-year dream? How do I manage my emotional boundaries? How do I take care of myself? There's specific topics, and that's a great meeting on
Awesome.
Mondays, the first Monday of the month at lunchtime.
Awesome. Awesome. Thank you so much for everything that you're doing and for all of your work and your dedication and for taking the time to being on the podcast. I really appreciate getting to know you better and hearing about all the work that you do.
Thank you, Jody. And I appreciate that I listened to a few of your podcasts. I appreciate how you are thinking and tuning and acting as a practitioner and as a podcast interviewer to let people know about this inner working, right? The inner working and the different healing that is the healing that's possible. Thank you for the care you took with inviting me and getting me prepared and to be able to do this with you. And thank you for your questions. And thank you for having the time to do this and for giving this gift to others. Because sometimes we don't know. That's the practitioner. We don't know what happens after that interaction is done. This is a very generous thing that you do. And
Oh,
then it can open up so much for people, for practitioners, for people. And I say thank you to you.
oh, thank you. That's my goal. That's my hope.
Yes. Thank you so much.